My name is Abdirahman Mohammed Ibrahim. I am the newly appointed Chief Officer for Medical Services, Isiolo County. Most importantly, I want to thank Allah and the Governor for Isiolo County for giving me this opportunity to serve in his administration. I want to assure the people of Isiolo that we are going to make sure that the promises this administration made during the campaigns will be met. Under my watch, we are going to have drugs in our facilities. We are going to help in logistics in trying to move our sick people for better referrals and better care wherever the need arises. The Governor of Isiolo County, Mr. Abdirahman, His Excellency is very passionate about the service delivery and in particular medical services. And under his leadership, I want to assure the people of Isiolo that they will find drugs in our facilities. They will find the necessary support needed to move our sick people. If there is need for referrals, we will make sure that the little resources we already have, we are going to use prudent use of it and seek for more resources from other partners so that we can be able to expand in terms of logistics, ambulance services within our county and referrals that are needed maybe outside our county. It is very important because the brief meeting I had, I told you I have not been here for long and I have not even taken over formally from my predecessor, but I hear then handing over notes already. So the few minutes I had with the individual heads of departments, they have told me that this hospital alone, Isiolo County Teaching and Referral Hospital, attends to over 400 patients, going to 500 patients a day. Is attended to. What are their needs? Because we will be collecting this data, the software I was talking about, it will give us an overview of the most prevalent cases that are usually in which facility, in which month of the year, so that we will know if it is in July, it's usually malaria time, if it is in what month, because of the data will be collected over time. Every organ doing what is expected to do. Those are the hospital in specific units within the hospital do what they are expected to do. We here at the middle management, in collaboration with our CEC, Dr. Loasa, and the Governor, we do what we are expected to do. The requisition they make, we make sure it's attended to in good time. Because if we do not attend to their requisition in good time, what happens? They will fail in delivering. If they fail in delivering, we all fail. The other thing, in the next few days, I will hit the ground running. I'm going to visit facilities that are outside Isiolo town, have a meeting, sit with the leadership of those particular facilities, have a meeting with the staff, understand the challenges that they are going through, and develop local-born mechanism, because the challenges that are at Isiolo County Referral Hospital cannot be the same as those the staff at Merti could be having. By identifying the individual challenges in each particular facility, we'll come back here at the headquarters and develop mechanism such that we can be able to address those issues raised at the ground, whether it is staff issues, whether it is drug issue, whether it is logistical issues, up to the level of the Governor, that we are going to make sure that there will be morale within the rank and file of the staff in terms of trainings, in terms of other motivations, including promotions, and general welfare of the staff, so that health being a critical service, we need our staff to be properly motivated so that they have the ability, they have the enthusiasm to be able to wake up every morning, late in the night, to attend to our people. There is the issue of drugs being stolen from facilities. I want to assure our people and that we are going to address that challenge, and we will make it a thing of the past. We will make sure we develop systems in our facility that will make sure our drugs, the drugs being bought and brought to the facilities, are utilized for the services they are intended for. I'm not talking about posting guards and spies and witch hunt, following staffs up and down and asking them, hii dawa ilikuwa imeenda wapi na hii ulikuwa umetoka pande gani? No. We will do things in a professional manner by adapting a system, coming up with a system that will run our facilities. We'll come up with a system that will run our facilities beginning from the point when a patient walks into the facility. We are going to have, when this data is being taken, the triage data is being taken, height, weight, blood pressure, body temperature. From that moment until these patients exit the facility, what problem was he, which doctor did he say, what problem was he diagnosed for, what treatment was he put in, was he an inpatient or an outpatient, and how did he leave the facility? What amount of drug was used to treat this particular patient, what was available in stock, until he exits, such that we can be able to identify from the system. On a click of a button, we will know what drug is available in which facility and what is the date of expiry for this particular drug. This will go a long way in helping us curb the theft of drugs and make proper use of the resources that has been trusted in our hands. This will also help the management of facilities to know what drugs are available, which drug is not being used properly or is overstocked in which facility, such that we can be able to transfer. If we have oversupply in a certain facility, we can move those drugs to another facility. There has to be that element of this person self-driven. How do you become driven? How can you attain that level whereby your job directs you without necessarily being supervised? Human resources structures in this country are very clear. If staffs are not properly motivated by ways of if they apply for trainings, these trainings are not done. If they are due for promotions are not availed to them, then the element of that personal growth is not there. So whatever staff you will be having in your docket will be those who feel like, I do not have anywhere else to go, so wacha tu nishikilie kwa hii job. Let me just hang around and hold on to this because I need something to eat. So those people will not give the necessary services required in a critical service provider like a health facility. So we are going to, I am going to look into the staffing structure of the department. With that, we are going to come up with a way such that people can be able to grow in their career. Grow in their career, move forward, the experiences they have gained below, they take it to a leadership level, even if it's a middle level management. I want to tell people, I want to tell the staff, I want to tell everyone who needs to hear this message, who has an interest in maybe in the docket that I've been appointed to, that I'm going to work within the law. I'm going to work within the law. There will be no favor. There will be no victimization. There will be no witch hunt. whatsoever. My interaction will be from the day one. How you do your work going forward, or what your superiors think about you in terms of the confidential report that may be there. I won't, but I'll be fair. I'll be available. I will give the necessary support required, because for everybody to be able to do what they are expected to do. To thank my predecessor, because I had the chance to sit with the particular heads of departments that he was able to put in place for what he was able to do. And I don't want to castigate or criticize on what he did, because I do not have the all facts right now. But I'll be my own man. I know what is expected of me, and I know my limitations. You know, expectations and limitations are there. When a patient walks into a hospital, these are people who are at their lowest moment, so they need to be handled with care, offered the need that the need that brought them there. Because casual people, it's not a mall or a business place or a cafeteria where people go to have fun. So people are in distress when they come to our facilities. I want them to feel that they have arrived at a place where they will get the necessary help they need. Services include human resource. The staff that we have in these particular facilities are up to the task, and that they are going to attend to our people. Other services may include equipment needed for treating these particular patients, lab facilities, x-rays, drugs. We're going to do everything within our means, because as I've said, you were not here when I answered that question. We have the commitment of the governor. He's so passionate about medical services. So, under his able leadership, we are going to make sure that our people will get seamless services at the facilities. If there is an element of negligence, there are ways of addressing that. If they travel if they work for extra hours, we need to find ways to accommodate them such that they feel that those extra hours are being compensated for. If it is an aspect of training, this person has been, the last time he was in class was 10, 15 years ago. If things change, medical is not like cast in stone. So things change. We need to train our staff so that they are in line with how things are moving in this world currently, very fast. So we'll train our staff, consider them for promotion when they are due. If there's a staff facing difficulty, it can happen sometime. Maybe this person is mourning, maybe he has been working far away from his family for a very long time. Consideration has to be given such that if this person has worked out of his home area for a very long time, it is only fair that he is transferred to a station near his family.